If you were a neurosurgeon and you had to take out a tumor or do some sort of surgery on something that is right near the tip of the basilar artery, how would you approach that case? There's a lot of things in neurosurgery that require operating on areas of the brain that are very difficult to reach. The area of the basilar apex is one of those areas. There's a number of approaches to get there, and I'm just going to talk about one of them. The Orbito-cranial approach is a modification of something called an orbitozygomatic approach, where we actually remove part of the orbit, the bone that surrounds your eye, in order to be able to access deep areas of the brain. In neurosurgery, you always have to think about visualization. How am I going to make my approach so that I can see what I'm operating on? Things are right around here. There's a lot of stuff in your way, all right? There's the skull out here, there's the whole frontal lobe laying down the anterior fossa right here. It can be very difficult to get very deep into the skull to do this type of surgery. And that's because the skull base isn't flat. There's actually lots of curves to it. And the anterior fossa is actually made up partially by the curves of the orbit, the bone that's surrounding your eyeballs and conveys the nerves that go to your eyes. While in the diagram here, it looks like, oh, the basilar artery is just a straight shot in here. If you look at this in a coronal perspective, you can see back the area where the basilar artery is actually very difficult to see because the bone of the orbit actually can get in your way if you really want a straight shot to see it. So what we do is, in addition to taking off a part of the frontal bone of the skull in order to see underneath the frontal lobe, we also will take out a part of the orbital rim. We just make a couple cuts on it and temporarily remove the top of the orbit so that when we're doing the surgery, in this little diagram, the blue things are retractors, just to show that if you actually can take off this bone right here of the orbit, then you can go right above and even push down the eyeball a little bit and pull up the frontal lobe to expose the brainstem, the basilar, the PCA, SCA, and even the temporal lobe back here, and you can see the carotid artery. And so you can see very deep areas of the brain by removing this frontal orbit. And this is one of the many ways that in neurosurgery we sometimes have to deconstruct parts of the skull in order to reach areas of the brain that are very difficult to operate on. And then in the end of surgery, we then can put the skull back together, close everything up, and it looks like we were never there.